We're in Wisconsin, but we're close to Milwaukee, which is definitely not a hotspot like some of the larger cities, but have seen a fair amount of cases. I think that the way that it's impacted us is twofold. One, when things sort of initially took foothold, we were very concerned that our hospital would become overwhelmed, there would be a surge, and resulting, we ended up delaying procedures that were sort of somewhat elective. It's hard to say elective when you have cancer, as a diagnosis, but we put off things that we normally would not have put off on. And so there's been delays in cares, unfortunately, in preparation for COVID-19. Fortunately, our hospital never hit surge capacity. And so now it's about reopening safely. And we're all adjusting to a new way of providing patient care. Much of my visits are now virtual. About half, I would say, are virtual visits. Some of our patients have to be seen in the hospital or they're coming for labs and treatment. And now we're seeing patients with significantly higher degree of precautions in place. We're doing lots of testing to ensure that we're keeping our patients who are hospitalized safe from getting COVID-19 from other patients who may be carriers and not know that they have it. So I really, I think that our center, like every other center, is trying to implement protocols and measures so that patients who have cancer, who are the high-risk patients for having life-threatening complications of COVID-19, given their immune compromised state, that they come to our cancer center and that they feel safe, and that we have appropriate measures in to protect them and still be able to deliver high-quality care. So the real focus right now is reopening safely, and we're hoping to do that as carefully as possible. But there's no doubt that myself and my colleagues, that the volume has gone down of referrals that we would have normally seen. So that could indicate one of many things. I'm at a larger academic center, so it could be that the community doctors were reluctant to refer the patients, or the patients were reluctant to be referred. Or it could be that even they aren't seeing the patient volume that they normally are because people are putting off medical problems. We've seen that with other diseases like heart attacks and strokes. There's a strong suspicion that people aren't coming in with those symptoms, and perhaps those people are suffering at home. I do think that there will be definitely an uptick of care that needs to be done, because cancer care is essential. It's not as elective as maybe a knee replacement or other procedures, where truly, it's more about quality of life. The care that we deliver, especially in hematological malignancies, is often, life or death type care. So those things can only be put off for so long before people get sick. And to be honest, even in the last 2 to 3 weeks, I've seen an uptick in the number of new patients that I'm seeing. Really, that in the month of March and April were non-existent.